Hello everyone, welcome back to my channel. This is RN Sakshi. So in today's video, we are going to discuss about cardiac output. So what's cardiac output? So in the picture, you can see that volume of blood pumped by heart in a 60-second interval, right? So how much your heart, pump the blood in 1 minute. So it's just a general broad terminology for that one. So in this, you can see that cardiac output is calculated as stroke volume into heart rate. That is known as your cardiac output. So before studying briefly what is cardiac output, what is stroke volume, and you know that heart rate, right? So all these measurements actually depend upon your three basic factors, which is your preload, afterload, contractility, right? Systemic vascular resistance. So these are the basic things on which your cardiac output is actually based. And in broader terms, I can say if your cardiac output is good, that means your heart is working well, right? So cardiac output means how the heart is functioning. Okay, so let's get started. First, we will discuss about the preload. So I will just try to make it in very concise manner for your better understanding. So for sure, so let's get started. So just on a note, cardiac output is the volume of blood flowing from your systemic and pulmonary cells. So basically, we can just see in the picture that preload is volume of blood received in your right atrium of the heart, the first chamber of your heart where your blood just get collected, right? In the picture, we can see how heart is putting that the volume of blood in just right side of the heart. So that's amount of blood receiving in your first right atrium of the heart. So in exam, you just don't have to struggle through it. You can just see how heart is putting the blood, right? So amount of blood the heart is receiving is just basically known as preload, and upon depending upon that volume of blood, how heart stretches. So preload is just a stretch, how heart stretches, right? So basically that's your preload. Okay, and afterload is pressure or resistance that heart has to overcome to eject blood, right? So afterload, we can say that tension, that pressure, right, that resistance which heart have to work hard and hard and hard and put up pressure and tension on it so that heart can just eject blood, so the blood can just reach to the systemic or your vital organs. So that resistance, that pressure is known as afterload. So in basic terms, we can say squeeze, right? So preload is stretch, how heart stretch, and afterload is squeeze. Okay, so that's the basic thing about it. So coming back to the point, now in this picture you can see that it's written what's preload. So preload is the degree of stretch in the ventricles at the end of your diastole period, right? So there are two periods. First is systole, second is diastole. What is systole? Systole means, you know, that's contracting phase, that's working phase of heart, when heart contracts. So that's your systole. Diastole is relaxing phase, when your heart relaxes. So that's relaxing phase, and that's known as your diastole phase. So around, like, when your heart is having the end of diastole, right? So that's the preload, like degree of stretch, which we can say like how the heart stretches at that point when at the ventricle at the end of diastole period. So right, so due to this, we can measure your central venous pressure around that time, which is 2 to 6 mm by Hg is the normal value of that one. So we can just evaluate how the right-sided heart is functioning at that moment, and that give the estimate of your preload or amount of blood, like how your heart is working. So that's the thing, that preload is just a degree of stretch, right? So once your diastole period, like once your heart is finished relaxing, and then afterwards amount of blood gets into the heart, that's your preload. So now there's just daily life based examples I will be giving you to get a thorough understanding of what is preload, afterload, and contractility. So think your heart like imagine that your heart is balloon, right? So you can see the girl in the picture who is trying to blow the balloon, right? So first we will see in the picture that there is preload. So in the preload section, we can say preload is the stretching of muscle fiber in the ventricle. I already told you that it's stretching of the heart. So the stretching results from blood volume in the ventricles at the end of diastole period. So diastole is relaxing. Once the relaxing phase is finished, then of course the heart will again stretch, which is your preload. That remember that picture, the heart is putting all of the blood in the right side of the heart, so that's your preload, right? So we can see like the more forcefully blow the air during the contraction or systole period, of course we can say that the more the balloon will stretch. So in that you can see that we can see the preload in the picture as balloon stretching as air is put into the balloon, right? So you can see the girl is trying to blow the balloon by putting the air how much she can, right? So the more the air, how much air you put on the balloon, the more there will be stretch, right? So you can see the more air she is putting, the balloon is just getting stretching and stretching. So that's your preload, okay? Similarly, in your second section where contractility is seen, so the balloon is stretching, right? So contractility, refers to the inherent ability of myocardium to contract normally. So contractility is influenced by preload. How your preload will be, like if your preload is good, contractility will be good, right? So the greater the stretch and more forceful the contraction is, like how far the heart is stretching, the greater the stretch, the farther the balloon will fly. How much air we are putting into the balloon. So if we are just putting less amount of air in the balloon will not fly, right? It will not just blow it in the air. But if we put more and more air into the balloon will just get fly over, right? So of course, like, so that's your contractility, like the balloon is flying as far as it can. So that's your contractility. But it depends upon your preload. Preload is blowing up the balloon with air, right? So contractility is how the balloon is flying. Same thing, the preload is your blood, right? And the stretch, how good the stretch the heart will get, how the volume of blood, if it will be good for the heart, it will stretch, it will work good, it will contract, right? So that's your contractility. So similarly, if we talk about the resistance, which is your, so same thing, last but the not least, that's your afterload, which is your resistance, which is your squeeze, the pressure, the tension which heart is having to just circulate the blood throughout the body. So in that last picture, you can see the girl is tying a knot on the balloon. You know that once the air is filled in the balloon, then we tie a knot, right? So that knot is known as your afterload, that we are creating a pressure for the balloon so that air can just stay in that balloon and the balloon can fly. So that resistance, that pressure that we are applying is your afterload, or we can say that systemic vascular resistance. So basically, preload is the amount of blood filling at the right atrium at the end of diastole period. So preload has a direct correlation with your cardiac output, right? How? More blood the heart will be receiving, the higher the cardiac output. Less blood, so less preload, so less cardiac output, right? So afterload is the pressure, the tension. So heart have to work, against when ejecting blood during the systole period. So this is directly correlated with your systemic vascular resistance. So resistance is, we can say, so sometimes we just get confused what resistance is, right? So resistance is like you have a water pipe through which you water the plants. But if you just put the thumb or your finger in front of that water pipe, there will be a pressure, there will be a backflow, right? So that's known as resistance, like when you put just thumb in front of that water pipe. So what will happen? The water will not just come out of the hose and all the water will just get backflow, and there will be a pressure or tension increased on the water hose, right? So that's your resistance, that just the pressure or the tension which is exerting, right? So the higher the pressure, the harder have the heart to harder the heart have to work to eject the blood throughout your whole body. Same thing with the hose, right? So like if you're just pressing the hose with your thumb or finger, harder the hose have to work so that water can just flow out and we can just water our plants. Similarly, heart, The higher the pressure, harder the heart have to work to push the blood through the vascular system. So simple as that, right? So preload is just a stretch, afterload is your squeeze, a pressure, and contractility is like how the heart is contracting, right? So simple thing. If I know sometimes we don't get the example on balloons. So balloons example, sometimes people just think that no, we didn't understand. So there is one more example which I'm going to show you, that how the preload, contractility, and afterload works with the help of a rubber band. So make sure you also grab a rubber band with me so that you can just better explore that ideology or analogy. Okay, so I have grabbed my rubber band. So like just practice it with me and just think that this rubber band is the heart. Okay, so now I'm just stretching this rubber band into the halfway, right? So now just think that what this stretch feels like. This stretch is pretty much good, and if I release it, then it just go back into the normal shape. So this is a good stretch. So that means a good stretch is a good preload, right? And good preload means that you're receiving good amount of blood. Good amount of blood means good cardiac output, right? Now the second thing, if I just stretch this rubber band just like that, so you can see that movement, it's very weak, right, flimsy, so it's not stretching good. So if there is no good stretch, no preload, no amount of blood, no good cardiac output, right? So preload is just directly correlational with your cardiac output. On the other hand, if I'm just stretching like that, you can see, right, it's just stretching. I'm just stretching it far way behind I can. So this is the harder the stretch, right? If I'm just pulling it out, I'm just breaking, like it can break. The rubber band can just break, right? Similarly, your heart muscle cannot contract and squeeze properly, and your cardiac output will not be good. So this will not allow your heart to fill the blood in an optimum level. So if there is no good amount of blood, all in all, if I'm just stretching like that, you can see the heart will not pump effectively. It will not receive good amount of blood, as this can break. Similarly, your myocardium or your cardiac muscle cannot stretch properly, and the heart will not receive proper amount of blood, and it will not lead to good preload. So no good preload, no more no good optimal level of blood. And if there will be no blood, then the heart will have inadequate functioning of stretching and squeezing, right? So similarly, preload is just directly correlation with your amount of blood and your cardiac output. Is preload is good, your cardiac output is good. But on the other hand, if I talk about your afterload, so afterload means the pressure, the squeeze. Like if the heart will just have more pressure, so it will have a hard time to adequately supply the blood. So if your afterload is increased, your cardiac output is decreased, right? So that's pretty much basic fundamental of that one. In my next video, I will be making some short and descriptive notes so that you can just write it down. This was just for your general ideology, that what preload and afterload and contractility is. And in that video, we will be talking about what is SVR, how to calculate cardiac output, what is normal cardiac output, and all that stuff. So stay tuned. Thank you for watching.